Hello everyone. Hello everyone. Today we are going to discuss digestants, carminatives, and appetite suppressants. Generally, these are all marketed products which are already available in market, which may facilitate or aids digestive functions. It may have many kinds of enzymes and the products with proteins and other natural supplements. Here you can see various marketed formulations like digestive enzymes, that is Zymex, next is Digeplex, next is superlactase enzyme, and the products from the Safi. These are all products generally aids or we can say improves the digestion. Here, in case digestions and carminatives are regularly used in food or in forms of food supplements. Here, it may act centrally as well as peripherally. In case of centrally, it could be orexigenic or anorexigenic. Orexigenic are NPY, next is agouti related peptides and the dopamine, whereas anorexigenic could be cocaine, amphetamine, histamine, or noradrenaline. Peripherally could be carlin and dynorphin, whereas in cases of anorexigenic peripherally acting, that is leptin and insulin regulation. Here, in case of regulation in terms of enteric nervous system, that is designed for digestive system or the processes which are going in digestive system will be governed by the neuroendocrine regulation or specific enteric nervous system. Here there are many factors behind the consumption of food or our food habits. There will be a major two factor, that is genetic factors and the environmental factor. It may involve in cases of genetic factor, that is hormones, neurotransmitters, enzymes and receptor, whereas environmental could be psychological aspects, which is cultural and socio-economic status of the person. Here, regulation depends on the intake of food. An intake of food may have a direct relation with the energy. In many conditions, energy intake will be high, whereas energy expenditure could be low, which could lead to the obesity. So overall, increased total caloric content will be increased and composition of the diet could lead to the obesity. In other cases where total caloric content may be reduced or less, in that cases exactly vice versa condition can be seen and we used to call it as a malnutrition. Digestions or appetite stimulants. These are the substances intended to promote digestion of food. A number of proteolytic, amylolytics, and lipolytic enzymes are marketed in combination formulations and are vigorously promoted for the dyspeptic symptoms and as appetite stimulants or health tonics. They are occasionally beneficial only when elaboration of enzymes in gastrointestinal tract is deficient. We can consider it as a part of nutraceuticals. Their routine use in tonics and appetite improving mixtures is irrational. So, it is advised that if it is necessary or prescribed, then only it should be consumed. First, that is pepsin. Pepsin is an important part in digestion of food material. and it may be used along with the HCl in gastric achlia, that is due to the atrophic gastritis, gastric carcinoma, pernicious anemia, where we can see that patient may be suffering from ulcer formation or ulceration. Second, that is papain. It is a proteolytic enzyme that is obtained from the raw papaya. Its efficacy after oral ingestion is doubtful, but it is believed that it is protein digestion. So it is prescribed to digest the food material. Third one, that is pancreatin. Pancreatin is a mixture of pancreatic enzymes obtained from the hog and pig pancreas. Generally, it contains amylase, trypsin, and lipase, and it is indicated in cases of chronic pancreatitis. See, pancreatitis is a condition where pancreas may be damaged due to injury, or it may happen that after any abdominal surgery, pancreas itself is not able to release amylase, trypsin, or lipase. In those cases, it is advised, or any other exocrine pancreatic deficiency states. Fat and nitrogen content of stools may be reduced and diarrhea may be prevented. It has to be used as enteric coated tablets or capsules, that is to protect the enzymes from being themselves digested or released in the stomach by pepsin. So always it will be given in form of enteric coated tablets, and those coating may be multiple. Nausea, diarrhea, and hyperuricemia are the occasional side effects that can be observed with pancreatin. Fourth, that is diastase and the takadiastase. They are basically digestions. These are amylolytic enzymes obtained from the fungus, that is Aspergillus oryzae. They have been used in pancreatic insufficiency, but efficacy is again equivocal. Fifth, that is methyl polysiloxane, that is dimethyl polysiloxane, simethicone, and dimethicone. It is a silicone polymer, basically silicone polymer with viscous amphiphilic liquid which reduces the surface tension and collapses froth and back, that is anti-foaming agent. It is not absorbed from the gastrointestinal tract, but it increases the chances that whatever the food material which is present in small intestine may get easily absorbed, and it is pharmacologically inert and it will not be absorbed from the gastrointestinal tract. It is added to antacids, digestion, and anti-reflux preparations. It is briskly promoted as a remedy for gas, a very common gastric complaint. It is also claimed to coat and protect ulcer surfaces, just like sucralfate, to aid dispersion of antacids in gastric contents and to further prevent the GERD, that is gastroesophageal reflux disorder. However, clinical efficacy is equivocal, and those could be 40 to 120 milligram 3 to 4 times a day. Next one, carminatives. Generally, we used to have a carminative regularly, and they are widely available throughout the kitchens. Example could be peppermint, ginger, chamomile, cardamom, fennel, and the anise. It promotes the expulsion of gases from the gastrointestinal tract and give a feeling of warmth and comfort in the epigastrium. In many cases where person may feel heaviness after meal, in those cases carminatives will be applied. Here, even sodium bicarbonate, that is plain water soda, with 0.5 to 1.5 gram can be used. Even peppermint oil in forms of 0.06 to 0.1 ml, cardamom tincture with 1 to 2 ml, oil of dill or dill oil, that is 0.06 to 0.2 ml can be consumed, and ginger tincture can be used in 0.6 to 1 ml. Generally, sodium bicarbonate reacts with the acid. Basic principles of antacids, right? So here it reacts with the acid and forms a carbon dioxide, and that released carbon dioxide gas may distance the stomach relaxes, and it relaxes lower esophageal sphincter, and it will be followed by the eructation, that is reflex that expels gas noisily from the stomach through the mouth, and we used to call it as like dakar. Other contents, that is volatile oils, which give irritant action with motility and relaxation of lower esophageal sphincter, which ends with warmth or warmth feeling and the comfortness. So, Carminative provides a better relief after food. Uses: it can be used in dyspepsia, where pepsin release may not be regulated, that is dyspepsia, and it may or may not with ulcer formation. Next is in cases of discomfort in upper abdomen, in cases of gas formation or patient suffering from gas, feeling of fullness, right? That is what is heaviness after food, and the burning sensation might be because of acidity. In these are all conditions, those carminatives and digestions can be applied. Next category, that is appetite suppressants, or a specific condition, that is anorexia, where patient may feel appetite suppressants, and because of this person may not have a regular food intake. It may be because of two basic reasons. One is socioeconomic status, and second, that is mental conditions. In many conditions, person may feel that he is or she is obese, so he or she used to refuses the food. Here, in cases of appetite suppressants, generally fat stores are determined by the balance of energy absorbed as well as expended. In many cases where energy intake is high and energy expenditure in the adipose tissues. Classification. First, there is centrally acting adrenergic agents that can be used to suppress, that is dimethylamine, phentermine, diethylpropionate, mezidol, phendimetrazine, and phenylpropranololamine. See, these are the agents which can be used in the treatment with anti-obesity, and they are not the first choice, but they can be given in forms of combination or with regimens. Next, that is serotonergic agents like dexphenfuramine, fenfuramine, and the fluoxetine. Next, there is adrenergic serotonergic agents like sibutramine. So this is the classification for antisuppressive agents. While coming to the side effects of it produces dizziness, insomnia, nervousness, digestive problems like nausea, constipation, diarrhea, and stomach pain. Here, they are majorly used in treatment of obesity. Here you can see some marketed products like Serofit, that is for weight management. Next is nighttime fat burner, that is again for obesity, and the extra slim. So this is all about digestions, carminatives, and the appetite suppressants. Thank you.